either you know the fact that the X-ray, let me just pull, I'm pulling something up as we speak because I want to show you something on my first aid. I love first aid. First aid is awesome. Is very good. Is very good. Yeah? Hold on. So here it is. So now we have this. Sarcoidosis right here. Let me open this up a little bit. First aid. I love first aid. I use first aid every day for step 1, step 2, for everything. Sarcoidosis. If you want to learn, right, the videos that I make, I specifically hit topics that are important, like sarcoidosis, for example. And then I don't want you just to read this and memorize it. Read it a few times and understand what this is talking about, right? It's immune-mediated. It's widespread. We have non-caseating granulomas. This is big. It's always on the exam. Elevated ACE levels. Oh, so we have to know that. Elevated CD4-CD8 ratio. More common in Black females, fine. They won't give you black or white. They just don't do that. Often asymptomatic, except for enlarged lymph nodes. Okay. Chest X-ray, bilateral adenopathy, which is hilar lymphadenopathies, and then extensive hilar established and absorbed, right? Associated with Bell palsy, parotid enlargement. Now, you can memorize this, or you could say, what do they have here? Oh, sarcoids. That's why first aid is first aid. They have a beautiful name. You can remember sarcoids, and say, well, okay, now I need to know what these are. I can take it a few times, review a few times, write it out a few times. And this can help you remember that calcium is high, that there's high ACE, high CD4, CD8, right? There's vitamin D activation. There's issues with the eyes, issues with the skin. Wow. And if they're symptomatic, you give them steroids. Oh, there it is. Okay. So watch this. Ready? Let me move my page. Watch this. So now you have to understand they're going to give you either the presentation of the case or they're going to give you an X-ray or both. And they're going to say, okay, we have to know this person has sarcoidosis. So this is what we think she has, right? Okay. Then we do, this is why AMBOSS helps all of us. Watch, ready? If you're not with me, because we're not together all day, you say, okay, well, I need to make sure that my thought process is on the right track. Okay, so I think it's sarcoidosis. Hit the tip. Let's see if it is. Oh, woman has some pulmonary symptoms, shortness of breath. She's coughing with no sputum. She's fatigued. Erythema nodosum. They tell you here on both shins. And anterior uveitis. They tell you injected, conjunctivate, and tender. They're not going to tell you the exact terminology you're going to find in your first aid. That's why it's challenging, guys, because when you're using Step Up and First Aid and Kaplan and all these different resources that we all use, the terms they use are very specific. And then on USMLE, they use something different. Well, that's not fair. Well, I know. Like, this is why the exam is the exam. So the more you review, you say, okay, well, when I see anterior uveitis, it's the same thing as this injected conjunctivate and tender, problems with the eyes, right? So if eye problems, shin problems, constipation, oh, I didn't realize that constipation could be due to high calcium. What do you guys know about high calcium? You should know about high calcium. Can you tell me in the chat here what you know about what is the body going to present with symptoms if it's high calcium? I want to tell me there's certain rhythm or song or mnemonic we use to remember it, but you should all know what happens if the body has high calcium, low calcium, high sodium, low sodium, high potassium, low potassium. You better know it because they're going to easily give you that.